Federal Labor has slammed the Commonwealth's handling of COVID outbreaks in aged care settings across Tasmania. It's calling for more rapid antigen tests and booster shots to be made available, with dozens of facilities now impacted.
Nearly a month after Tasmania's borders being thrown open, the state's aged care facilities are now in the firing line of the Omicron variant.
The reality is here that we're looking at the single most vulnerable group of individuals in our community housed in one place.
Advocates fearing the worst for what's to come.
I don't think there's any question that we'll see deaths coming out of aged care.
Federal Labor MPs are fed up with the government's hands-off approach, today urging the relevant ministers to step up.
If we had access to more rapid antigen tests, people could be testing themselves each day in those critical industries and know whether they should go to work.
With staff shortages already bearing down on the industry.
A third of aged care homes in Tasmania in lockdown, effectively condemning elderly people to solitary confinement away from their loved ones.
Southern Cross Care in Newtown is now among the 24 homes impacted. This letter sent out to families overnight, informing them of a resident's positive result. The documents obtained by 7 Tasmanian News say the Rosary Gardens facility has enacted its outbreak response plan, seeing residents isolated to their rooms and visitation limited.
Given the nature of Omicron and the fact that it spreads more readily than Delta before, it has to be a significant concern.
Aged Care Services Minister Richard Colbeck says the government has prioritised vaccinating aged care residents, with the Booster in Reach program starting in November. Also adding rapid antigen tests are being made available to all residential services.
What we need to do is make sure that we've got as many people as possible, whether they be residents, staff or visitors, going into aged care to have their booster shot as quickly as possible.
Grace Evans